Hello everybody, welcome back to the next video. Today we are going to make another video. This video is about peak flow reading, how you take the peak flow reading and how you document it, and what's the explanation to the patient about the readings. Let's do it. Let's start the video. So guys, this is the station where after pre-procedure introduction you are going to prepare your patient. Yeah, in most of the other skills we need to prepare the equipments. Here what equipments we have? We just need the alcohol hand gel and we need a peak flow meter, and that's it. Yeah, so you need to make sure you do the hand hygiene as appropriate or as needed, and you explain the procedure to the patient appropriately and wisely and precise. It should be precise and short, easy to follow for the patient. As I said, we are going to prepare the patient. We need to ask the patient what are the peak flow readings, what are their current peak flow readings, or what are their peak flow readings have been recently, and what position do they use to take the peak flow reading. Do they stand up to take the peak flow reading, or do they usually sit down to take the peak flow reading? And also here we need to ask the patient if they have their own peak flow meter. If they do have their own peak flow meter, we need to ask how long they've been using it for. So because usually it's valid for only 1 year. What happens with the continuous use? There is a spring on it, right? On the peak flow meter there is a spring. It gets slack and will not give you accurate reading if you use it more than a year. So just explain it to the patient, ask them how long they've been using it, and then if they say it's more than 2 years, more than 1 year, if they say more than 1 year, they need to buy a new one. They cannot use the same flow meter for years. It's only valid for 1 year. You are the patient educator. You need to tell the patient that now is the time you need to buy a new peak flow meter, because otherwise you're gonna get wrong readings each time. So this is the patient preparation we need to do. We need to know the patient, we need to know their position that they use, and we need to know how their peak flow readings have been. What's their normal readings? So we have explained the procedure to the patient. We can tell them, can you please adopt the position that you use to take the peak flow reading, and then they will decide whether they do it as sitting or they do it as standing. So after adopting the position, you can also explain it to the patient that please do not bend or extend your neck. Yeah, we need the full expansion of the lungs, so need to sit upright or stand upright. Yeah, and they should not flex their neck. They should be sitting upright or standing upright with their necks extended, with the proper expansion of the lungs. Yeah, just to avoid any positional obstruction with taking their peak flow reading. Now our patient is prepared. We need to prepare our equipment. We are only using peak flow meter here. We need to prepare the peak flow. Yeah, so we need to push. There is a needle or a spring, whatever you said. There is a needle on the peak flow. You need to push it down to 0. Some people, they say it's a gog, so just push the gog down to the 0 before use it. And then if your patient doesn't know or they haven't used it before, you need to explain it to the patient how to do it. You're gonna give them an example by doing it. Yeah, you're using the mouthpiece, the disposable mouthpiece, to explain to the patient. If they have their own peak flow meter, they can use their own peak flow meter. You're gonna do it with the other peak flow meter, or just use a new mouthpiece, disposable mouthpiece, so you can discard it afterwards. Now our patient is ready, our equipment is ready. I'm just going to perform hand hygiene before I start the actual procedure. I'll tell the patient, please take a deep breath as much as you can for full inspiration and for the greatest achievement of the breath or the air. Now if even your patient says, I know I've been doing it for years, but guys, remember, it is your test for the explanation of peak flow reading. It is your test. The examiner, the assessor, they want to know if you can explain to the patient correctly, precisely. So this is your test. So you need to know how to educate the patient, because you are patient educator as well. You are going to educate the patient how to do the peak flow reading within the time provided, within the exam session, how to do it correctly, precisely, and make your sentences short and clear. That would be to make it easier for the patient to follow. So ask the patient to take a deep breath. They have taken a deep breath. Now what are you going to tell? You're going to tell them, make a seal around the mouthpiece. Make a seal around the mouthpiece with their lips tight around the mouthpiece. Here you need to also remember that the inspiration, the air that they have taken in, they should not hold it for longer than 2 seconds. Yeah, so they have made a tight seal around the mouthpiece. Now what they need to do, they need to blow out into the peak flow meter as hard as they can, right? It's like that. Make a seal. Yeah, that's the procedure, guys. I don't have the peak flow here at home, but I can show you if you want me to show you how to do the peak flow, but I'm explaining it. So they need to take a deep breath, make a seal, yeah, and then they need to blow it hard as much as they can to get the accurate reading of the peak flow meter. So you're telling the patient, make a seal around the mouthpiece, take a deep breath, make a seal, and then give it a short sharp huff. Short sharp huff. Short sharp huff. This is the short sharp huff. Okay guys, so make sure you explain it to the patient, and then you need to also tell them that you need to put your lips around the mouthpiece, and by ensuring that your tongue or teeth, they are not obstructing the airway or not obstructing your way of blowing out. So we have taken the first reading. You need to take note of that reading, write it down, push the needle or gauge down to 0, give the patient few minutes if they want to, 2 or 3 minutes if they want to rest, and then you are going to take another reading. So like this, you need to take 2 more readings. So there are total 3 readings for the peak flow reading. If there is a difference of 20 liters per minute in 3 readings, it's good. But if there is a difference of 40 liters per minute, then you need to take additional 2 readings. But guys, before doing any reading, you need to explain it to the patient in the beginning. I'm gonna take 3 readings. If there is a difference of 20 liters per minute, well and good, I will not repeat it. But if there is a difference of 40 liters per minute, I may need to do 2 additional readings. Just clarify with the patient that they can do their best within the 3 readings. And it's ideal to have the difference of 20 liters per minute. So you're gonna do 3 readings to get a difference of 20 liters per minute. If not, if 40, we're gonna repeat. And also we need to make sure the patient rest in between the readings. If they feel breathless, if they have any kind of problem or something, then they can rest in between, because it's tiring. If especially for patients who are COPD, or if they have any pulmonary problems, it can be difficult for them to do the peak flow reading, giving a short sharp huff, guys. So just ask the patient if they are comfortable doing it. If they have any problem, you can stop it and then give them some time and do it again. And then after taking see, I did not mention one thing. While they holding the peak flow, you need to explain it to the patient that please hold the peak flow horizontally into your hands, but ensuring that your fingers, they don't come in the way of the gauge, in the way of the needle. So you're gonna explain it to them how they're gonna hold the peak flow and how they can read, how they can take the reading correctly at home. And also you need to document all 3 readings and then compare with the previous reading, and then explain. There is a predictor chart. You need to tell them that after checking on the predictor chart, you need to tell them that if it's correct, if it's all right, or they going to feel better, are they feeling better, or if they're doing good. If not, you're gonna refer it to the GP or to the doctors, that if their peak flow reading is below their age level or below their normal level, we're gonna inform the doctors. Now after that you need to perform hand hygiene, discard the mouthpiece if you're using disposable. If the patient is using their own, they can have it, but we need to clean it, thoroughly clean it, and then give it back to them. If you're using disposable, you can just discard it right away. And also at the end you are going to discard the things that you used, and then wash your hands, clean your hand, and leave the patient safe and comfortable. I'll show you guys. This is the form that they used, where we need to document all the readings, all 3 readings. So we have peak expiratory flow rate chart, patient name, date of birth, and normal values for peak expiratory flow rate. Yeah, so here on this side it says PEF, liters per minute. This is the reading we got. Yeah, and then on the other side you have height of the patient, and then at the bottom you have age of the patient. So in the request form, so this is the paper they're gonna give you: assessment documentation, peak expiratory flow rate, patient candidate name, and that scenario here. And then they also, it will be pre-filled, patient details, allergies, height, first reading, second reading, third reading, and the highest of all these 3 you're gonna write it here. Okay, so let's say I wrote my first reading is 380. I will write it here. 400 the second reading, and third reading is 420. So this is the form you also need to complete when you do peak flow reading. They will give it to you in the exam. And then also after that, after completing that form, you have this one, normal values for peak expiratory flow rate. This is the form you are going to compare with. You are going to check on this form if your patient's readings are accurate according to their age or height, or their according to their height and their age, if these peak flow readings are good for them or not. So as I said, my patient is 60 years old, 152 centimeters. It's a female. Okay, I'm just making a scenario for you guys. So she is a female, 60 years old, 152 centimeters. So here if you look, the bottom part is 152 centimeters or 60 inches, and the upper one is 60 centimeters or 63 inches. The upper one 167, all goes above like that. So for our patient it's 152 centimeters and she is 60 years old. So we are going, the first line belongs to the bottom, the first reading. 152 centimeter goes with the first reading, 160 with the second, 167 with the third, 175 with the fourth, and 183 with the fifth line. This is how you need to see it. Okay, make sure you familiarize yourself with this form. All right, so now my patient is here, 152 centimeters, 60 years old. 60 years old goes here. This is the point, and 152 is the first line. So here 152, 60 years old here. Now here I need to go through this. I need to just follow the section here. Here, am I going right? Yeah. So it says here 370 to 400. 370, no, here 370 to 390 is the normal for this patient. Our line is touching here, that is 390, almost 385. So from 370 to 390 or 400, it's normal for this patient. Our patient got first reading 380, 400 the second, and then 420 the third. So it's normal for them. There is nothing to worry. This is the normal reading according to their age and height. So we are not worried, but still you're gonna tell the patient you are doing great with your peak flow reading. Nothing to worry. Keep doing as you're doing, and then we will see you soon with your next appointment. Guys, I hope this video was helpful. We need to take the flow meter readings. We need to document on the first, second, third reading, the first form that I showed you, and then we need to compare it with the normal values. This is the complete procedure for the peak flow reading. If you want to see the complete video of how to do peak flow reading, I have a YouTube video on my channel, and I'll put the link in the description for you guys to see how to do it, how to explain to the patient properly, and how to do it precisely. Okay, I hope this video was helpful, informative. If you like the video, please give it a big thumbs up. It keeps me motivated, it keeps me happy, and then allow me to make more videos. I hope this video was good, helpful, and then I'll make sure I'll come back very soon to make I'll come back very soon, and I'll make another YouTube video for you guys to help you guys to pass your Osce exam. It's easy, guys. Take it easy, no stress. You know all these stuffs, you've been doing it for years. It's nothing major, nothing serious. Just take it easy, and then remember me in your prayers.